Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is borderline personality disorder. Borderline personality disorder is a complex and often misunderstood mental health condition marked by emotional instability, impulsive behavior, distorted self-image, and turbulent interpersonal relationships. People with borderline personality disorder often experience significant distress that affects multiple areas of life. Borderline personality disorder is defined by a constellation of emotional, behavioral, and cognitive symptoms, including fear of abandonment, where there is extreme anxiety over real or imagined rejection, unstable relationships, where there is alternating between idealization and de-evaluation, emotional volatility, where there is intense, rapid shift in moods, impulsivity, where there is risky behaviors such as unsafe sex, binge eating, or reckless driving. Chronic emptiness, where there is persistent feelings of internal void or meaninglessness. Inappropriate anger, where there is frequent intense outbursts or difficulty managing rage. Transient paranoia or dissociation, especially during periods of stress. Unstable self-identity, where there is an inconsistent sense of self and personal values. Though borderline personality disorder is distinct, it often shares traits with other personality disorders, which can complicate diagnosis and treatment. Understanding these overlaps is crucial for accurate clinical assessment and planning. Let's review some of those overlapping traits. With histrionic personality disorder, shares the emotional intensity, attention-seeking, and dramatic expression. With narcissistic personality disorder, shares the sensitivity to rejection, unstable self-image, and need for validation. With antisocial personality disorder, shares the impulsivity, risk-taking, aggression, and disregard for consequences. With dependent personality disorder, shares the fear of abandonment, clinginess, and difficulty with independence. With avoidant personality disorder, shares the sensitivity to rejection, feelings of inadequacy, social withdrawal, but there is less emotional reactivity than with borderline personality disorder. With paranoid personality disorder, shares the distrust, suspicion, and hypersensitivity to betrayal. With schizotypal personality disorder, shares the dissociation, paranoia under stress, magical thinking, and social anxiety. While many of these personality disorders share emotional or interpersonal features with borderline personality disorder, what sets this personality disorder apart is the intense fear of abandonment and profound identity instability that drive much of the behavior. For instance, narcissistic personality disorder traits often stems from shame or ego defense, whereas borderline personality disorder traits emerge from emotional vulnerability. Let's look at these two personality disorders more closely. Core fear: in borderline, there is abandonment. In narcissism, there is shame, inadequacy, and exposure. Motivation: in borderline, they avoid emotional pain or abandonment. In narcissism, they maintain control and ego gratification. Emotional tone: in borderline, it is reactive, intense, chaotic. In narcissism, it is calculated, cold, self-serving. Common behaviors: in borderline, there is guilt-tripping, threats of self-harm, idealization, de-evaluation. In narcissism, there is gaslighting, love-bombing, and exploitation. Awareness: in borderline, often unconscious and fear-driven. Narcissism, often conscious and intentional. Empathy: in borderline, is present but unstable. In narcissism, is largely absent. In relationships: in borderline, is intense, clingy, unstable. In narcissism, it's superficial, exploitative, and emotionally distant. Manipulation in borderline personality disorder is usually an unconscious plea for connection fueled by emotional dysregulation. In contrast, manipulation in narcissistic personality disorder tends to be deliberate and calculated, aimed at securing admiration or control. Common questions to assess for borderline personality disorder include: do your relationships involve frequent conflict or breakups? Have you engaged in self-harm or suicidal behavior? Do you act impulsively with spending, food, or substances? Are your moods intense and unpredictable? Do you struggle with anger or lash out emotionally? Do you often distrust others? Do you feel disconnected from reality or your surroundings? Do you experience chronic feelings of emptiness? Do you have difficulty defining your identity? Have you made desperate efforts to avoid abandonment? Now let's visit a more spiritual perspective regarding borderline personality disorder. From this lens, this personality disorder is sometimes interpreted as a manifestation of deep soul-level wounds and energy imbalances, such as wounded inner child arising from unresolved childhood trauma or emotional neglect, soul fragmentation, where trauma causes aspects of the self to splinter, needing reintegration. Karmic patterns, repeating emotional themes linked to past experiences of betrayal or loss. Disconnection from higher self, where emotional turmoil might reflect spiritual misalignment or lack of grounding. Such perspectives, while not clinical, might complement traditional treatments by fostering holistic healing and deeper self-awareness. In conclusion, borderline personality disorder is a profoundly painful condition that impacts every facet of life, from relationships to self-perception. While it shares traits with other personality disorders, its roots lie in emotional vulnerability, fear of abandonment, and identity confusion. With accurate diagnosis, compassionate care, and for some, a spiritual healing path, people with borderline personality disorder can achieve emotional balance and lead meaningful lives. May the inner peace we cultivate today expand and guide us always. Until next time.